everyone, this is Jill Hurston, marketing team at Excellarate. Welcome to episode 25 of our Zip Chat, Streamlining the Prior Authorization Process. So with that, I'd like to introduce our host today, Pankaj Jain. He's our SVP of Software Services. Pankaj, I'm going to just turn this over to you.
Thanks, Jill. Good afternoon, and everyone, and welcome to today's Zip Chat. One thing I want to make sure, audience, please ask your questions through the Zip Chat via chat box. I'll try to get all the your questions answered via our panelists. Prior authorization, I know, but as a patient, when I visit my doctor a while back, and then doctor prescribed me some diagnostic test, and in a couple of days, I went to the lab and took my diagnostic test. So most patients don't realize that there is this process exists called prior authorization that happens behind the scenes, and that's what makes the magic happen. And that is exactly what we'll be covering today. I'm glad that we have Lori, Tommy, and Monique to cover the topic in detail. Lori Myers she's our health tech SME. Monique Wing is our business analyst at Excellarate, and Tommy Chen is the FPN architect. So with that, Lori, let me turn to you and explain. Can you explain at a high level what prior authorization is? Can you set up the context for today's discussion for our audience?
Absolutely. Thank you, Pankaj. So what is prior authorization? It is a management process used by the insurance companies to determine if a medical procedure or a pharmaceutical product or service will be covered under the patient's insurance plan. So health plans require physicians and other healthcare professionals to obtain advance approval before a specific service or product can be delivered to the patient in order to qualify that for payment coverage. If the service is provided ahead of time prior to the health plan's approval, the healthcare professional is running a high risk of not getting paid for that service or product that they're providing. And that includes medical services, imaging, advanced imaging, lab work, medications, pharmaceuticals, and things like durable medical equipment. So it's very broad reaching and impacts a lot of transactions.
That is great, Lori. Can you now explain some of the pain points around prior authorization?
So the big pain points is the process is a lot of administrative burden. It is typically a manual process within the providers, and it's very time consuming. The American Medical Association has done some studies, and they have indicated that per physician per week, people are spending upwards of 2 business days. That's 2 full days out of a 5-day work week in doing nothing but prior authorizations. So, in long story short, it diverts a lot of valuable resources away from patient care. It can result in delays in treatment and patient care, ultimately impacting, the health outcome of the patient and the overall quality of the care.
Seems like a pretty complex process.
Yes. And the process is often long and complex, as you mentioned, and it varies by the different health insurance plan. So a doctor seeing, a number of different patients, each patient coming in with their own health insurance, his office has to do this multiple times in multiple different ways.
Wow. Oh, that's a great overview, Lori. Now let me turn to Monique, who worked with you to drill down the high-level requirements, working on this project. So Monique, over to you. If you can, so one question that I want to ask you: before working with Lori, did you had any experience with prior authorization?
I was familiar with prior authorization. However, for this particular project and this engagement, it was going to be for a proof of concept, a POC. So I needed to speak with Lori as a subject matter expert to narrow down what exactly we wanted to demonstrate, what particular portions of prior authorization we wanted to highlight for the proof of concept.
So that great. So Lori, can you briefly explain why you choose this as a scope for this project?
Prior authorization is, like I said, complex, and it intersects with three different entities. So you've got the provider communities, physicians and pharmacies. You have the payers and the payers and the health insurance companies, and then you have the patients. And a lot of the administrative burden is specifically around the providers getting their data, what services that they have provided to the patients, what services they need to provide to the patients, and putting together the medical necessity and the business requirements to make an argument and a plea to the insurance company for approval and payment. And so they have a lot of different moving parts, and so that's one of the biggest challenges that currently exists is how can we make the provider process work more effectively for them? And that's why we targeted our proof of concept for the provider space.
Okay, great, thanks. Monique, please continue your involvement in this project.
So as Lori was just describing, for the POC, she wanted to hone in on the physician's interaction with a healthcare provider, with a health insurance company as far as prior authorization. So when you're doing any project, and especially for POCs, you want to make sure that you are in line with the subject matter expert on what the scope is, so that you make sure that as you start to gather the requirements, you are in line with what the scope is. So as she explained, we were going to look at it from the vantage point of a provider that was going to interact with the health insurance company to do a pre-authorization for a payment for a patient for a specific procedure. And so I met with her to discuss that, and I also wanted to discuss what would be success. So as she's touched on, this was a very manual process. So we wanted to see if we could leverage development that was going to make it more automated, something that could also handle intelligent document processing, because you're dealing with physicians' offices, some which still use handwritten notes, structured and unstructured notes. So we wanted to make sure the development could address that. We wanted to look at the throughput time. As she explained, this process can take 2 days, 2 full business days to complete out of a 5-day work week. So that's a lot of time spent on just this process. So those are just some of the things that she identified, that if we could address those in the POC, that would be something to highlight as to how we could add value and improve this process with the development that we were proposing. So after we did that part, then we went on to actually looking at the process itself, to talk about whether or not, well, we want to talk about the process. We want to break it out into chunks. And so I did storyboarding, which normally before everybody was online, you could do with a whiteboard in a room with people and kind of draw it out. But because we were online, she and I kind of just had conversations, and I did use the technology available to me to share my screen so that she could see how I was capturing the story in the as is, and how I was highlighting what she was saying, just to make sure that I was tuned into what she wanted to focus on. And it also helped her as she started to gather her thoughts about what she wanted to explain to me, so that I would be able to explain that to the developers and that they would be successful. So we went through the storyboarding process, and that took maybe five, 6 meetings between Lori and I, and it was really helpful because she's very knowledgeable on the subject and could answer a lot of my questions. So once we went through the storyboarding, then I was able to construct the as-is process and workflow. And from what she said were her desires to be highlighted in the POC, I was able to create the to-be process and to create those workflows, and from that, start to create requirements and user stories for development.
That's great. So at this point, it's still the discussions are between you and Lori. It's not like Tommy is not involved yet. Tommy, your turn is coming. I mean, we'll get to you as well. But so Lori, could you provide your experience like working with Monique in terms of storyboarding and especially in this remote environment? What was your feedback? How did the process went and how long the process was?
So it was working with Monique and drilling down into the requirements and the process flow. It was very rewarding because what we were able to do was kind of put ourselves in the shoes of a provider and saying, okay, what are they doing? And you kind of have to understand the prior authorization process as a workflow for what the provider does, how they communicate and send the data over to the insurance company, how they kind of wait until they get a disposition back from the insurance company and have to do follow-up to understand then what are their next steps so that they can actually deliver care then to the patient. And going through all of these steps was very informative because it helped us to kind of lay out opportunities that we could bring value to the provider community. And we were able to then pull together use cases, as Monique was talking about, so that we could then engage Tommy from a technical perspective. So it was it was a lot of thought process, and again, understanding what the administrative tasks were that the provider community is needing to execute on.
Great. So Monique, at this point, like that's a great feedback, Lori. Can you drill down a little bit more work what you needed to do before you involve the Tommy?
So as I was expressing earlier, I started to create documentation and using a repository that was available to our team, provide Tommy with documentation that would describe what were, like I said in the beginning, what's the scope? What position are we in? Are we coming from creating this POC? What is a definition of success? So he knows what we're marching towards to be able to demonstrate that this is going to be development that's going to, and this is going to enhance the process. Also, my documentation provided to him some of the major pain points that they had. So things like I was talking about before, being able to translate handwritten notes, being able to automate workflows, being able to capture EHR data via APIs, and also use RPA for some repetitive tasks that were a part of the process. In addition, I was able to give him that as is in the 2B workflow, so he could also leverage that and understand what the flows look like from start to finish in the present tense and what we wanted it to be in the future tense. And so by giving him all of that information, he was then able to step back, digest the information, and then formulate any questions he might have or any suggestions or any roadblocks before we were to even engage in the development. Because as much as you can do on the front end, that just helps development go a lot smoother and faster, and you can get product out of the door that's going to be of quality in a better way. So after I was able to create all that documentation, then that's when I would engage Tommy so I could get his feedback as well as getting Lori's feedback from what I had gathered and from what his feedback was.
That's great. So, so this process went back and forth between you and Lori, and now you have a documentation and the workflows all define what you are trying to automate. And now you involve Tommy. So Tommy, over to you. The same question I ask you, which I asked Monique as well. Before Lori and Monique reached you, did you hear about prior authorization? Do you had any knowledge about prior authorization?
No. So I'm Canadian. I live in Canada, so we don't have this process here, I believe. So this was all very new to me and very exciting, since it looks like there's a lot of redundancies that the technology can get.
Okay. So can you explain your role at Excellarate, and when you heard from Lori and Monique all the documentation, and you said because they are coming to you to develop this POC, did you find like build from scratch? What was your initial thought? How did you react to these requirements?
Okay, so I'm an architect here at Excellarate. I have been working with local platforms for over 10 years and large corporations and the government. So when I heard about the prior authorization, I thought this was a great opportunity for a local platform. The reason being that I have implemented local platforms for many complex solutions previously in the past, and a lot of business ideas, pain points could be automated easily with the local platforms. Local platform allows a low barrier to entry for innovations and new ideas. And in our real world experience here at Excellarate, we can deliver apps 10 to 20 times faster than legacy Java or C# development using local platforms.
That's great. So for this POC, which platform did you decide to use, Tommy? I'm sure you are a Appian architect, so but just wanted to understand your thought process. Which platform you use for POC?
No problem. So yes, Appian is our preferred partner for low code. Based on Gartner and Forrester ratings, Appian is consistently in the lead with respect to ability to deliver and innovation.
Mm-hmm.
Low-code platforms such as Appian will always, reduce strains on IT resources and increase speed to market. But it doesn't have to be Appian. We could use other platforms as well.
Okay, great, great. Let me interrupt at this point. There is a audience question. Anybody, Laurie or Monique or Tommy, you can reply. One of the concerns, the question is about prior authorization. Anything in dealing with the healthcare, obviously the HIPAA compliance comes into place. So the question from the audience is the automation takes care of the HIPAA compliance and all the security issues around it in the requirements section?
So Appian is HIPAA certified, HIPAA compliance certified. They also have high trust certification, and they have a variety of other certifications along with SOC. Okay. So they have a variety, they have gone through a lot of due diligence and have achieved these required certifications.
That's great. Good. Hopefully, the person who asked, I hope you get your answers. So Tommy, coming back to you again, given this requirement, so can you walk us through your process, what you went through, and how your work in terms of automation eliminated some of these manual workflows Monique described?
Okay, just want to add on to the HIPAA security requirement. So Appian Cloud is compliant. So we can securely store protected health information on Appian Cloud. And as for automation, yes. So it looks like there's a lot of redundancies and lots of time spent working manually in this prior authorization. So automation, if done right, it will always save time. Employees will not need to spend as much time on repetitive tasks and can focus on other important healthcare issues. So, and automation can always perform tasks faster than a human ever could. So what we did was we integrated the project with the electronic fax platform. So workers do not need to physically print out the submission forms or any documents and fax them manually. And same thing as receiving it and printing it out and looking at what was a response from the payers. So we integrated with the electronic fax platform so that they can save time just doing this portion. Mm-hmm. We also integrated with the EHR system, so we can pull all the relevant information and rules without people having to double check and going in between the systems. We also integrated with Google AI Vision, so using its optical character recognition capabilities, we can recognize handwritten notes from doctors, and that will save a lot of time there for physician assistants. We also can recognize responses from faxes, the electronic fax from earlier, to see what the response is from payers. So we can automate approval and rejection workflows this way by saving the time, even more time for the physician assistants.
That is great. How long, Tommy, it took you in terms of, and if you can explain, you alone did this work automation, or you had a team of it, and how long it took you to automate this workflow process?
So for this workflow process, it took 2 weeks, and we had myself and a junior developer to work on this. So this covers creating web APIs for integrating with the EHR system to pull all the client information and rules. Also included the eFax platform integration, where we can send and receive PDF documents. They also included integrating with Google AI, where we can use its capability to recognize the handwritten notes from doctors and also the responses from the payers.
Okay. I see a lot of questions are coming on. I'll just ask, I'll get those questions soon. Let me just ask Tommy one last question from my perspective. Like, can you, Tommy, explain, were there any challenges on the technical side, or any biggest challenge you face in the POC development throughout all the different things you did? What was your biggest challenge?
So there were no major blockers. The challenges were understanding, the requirements and the pain points where we can find the right technology to expedite the process. So finding the right AI technology to recognize the handwritten notes and the right eFax platform to be optimized.
Thanks, Tommy, for the explanation. It seems that automation significantly eliminated this manual processing and improved the process accuracy, which is the most important thing, I think, resulting in cost savings for the providers, obviously. So a couple of questions are lining up, so I'm just going to ask those questions, and Laurie, Monique, Tommy, please jump in. So one question is, like, in intelligent automation, you can do so many things. Is the healthcare space, Laurie, to this question to you is prior authorization is the only case for intelligent automation, or are there any other use cases as well?
Oh, that's a great question. Thank you. Prior authorization is a use case for intelligent automation. We prioritize that particular use case in our proof of concept because of the challenges in that space. But intelligent automation actually blends together multiple technologies, including artificial intelligence, low-code, no-code application development, workflow management, RPA, and bots for robust intelligent automation. So prior authorization was our first use case, and there are many others, such as registration with your providers, whether it's a hospital or a doctor, being able to automate that process of streamline that, communicate and exchange the data with some of your other providers is certainly another use case, as well as scheduling and follow up on all the appointments. How often does a person go and see their primary only to get referred to someone for getting lab work, another organization for getting imaging, and then only to schedule an in or outpatient hospital visit? So you've got multiple appointments, and automating and using intelligent automation for such as the scheduling process would be a significant use case to target.
Great, thanks, Laurie. Bob is asking question to Tommy. Tommy, this question for you. Is Appian the only choice for intelligent automation, or can we substitute with another technology? What's your opinion?
So Appian is not the only choice, but anyone who is thinking about doing something similar should really examine Forrester and Gartner's respective literature as a primer and engage with vendors for practical responses to the business needs. Appian happens to be a tool that we are most familiar with, and we had remarkable success with it. But like I said, other tools could meet the needs as well.
Okay. And one audience is asking, Laurie, I think this goes to you. I don't even understand the thing, but it talks about FHIR, FHIR, prior authorization and reformation, and question mark. So I don't know what it means. So if you know, can you explain this to our audience?
Yes. So FHIR is part of the HL7 international group. It's a standardization of APIs and how it data and exchange of data is going to occur. So for prior authorization, you have to really understand all the parts. So it starts with the EHR system and communicating and extracting using FHIR and the FHIR APIs of extracting the data and communicating that over to the payer community. So the challenge is currently the payer community actually requires the data in a different standard, in an X12 healthcare transaction set of a 278 and a 275. So, so we can get the data out of the EHR and we can set up a FHIR API to send the data, but the payers can't accept it yet. So there is a very large project that's been underway called the Da Vinci Project that is working to accelerate the adoption of HL7 FHIR as the standard for exchanging data, but we're not there yet. And come January 1st of 2023, certain payers in particularly CMS regulated business, such as Medicare and Medicaid, will need to be going over into that direction. Right now, it appears that there's going to be a third-party transformation layer that's going to take the FHIR data from, or take the FHIR transactions from the providers. They're going to go through a transformation layer and they're going to convert that to an X12, send it to the payers, and conversely, once the payers have made a determination, they'll take the X12 data and they'll put it back through the transformation layer, converting it back to FHIR and sending it back to the providers. So they've now set up like this third-party administration layer. I know that's complicated. There's a lot of documentation on this.
Yep, thank you. There are a lot of questions on the technical side of things. David is asking, this goes to you, Tommy. He heard you say like you use the Google AI engine for document processing and processing the doctor's handwritten notes. He wanted to understand, like, are there can you integrate in your POC other tools, like if the company, the hospitals are using the other AI tools, and can you talk a little bit about any challenges you faced in terms of recognizing handwritten notes? Were you able to, the question I think is asking is, were you able to, using the Google AI,
Yes, so
figure
Google
out
AI.
everything, or there was some like manual stuff needed to be done to understand?
Okay, so do we have to use Google AI? No, we can use any other tools that has AI capabilities. We chose Google AI just because it was convenient and had a high success rate, but we can use any custom solution that the hospital uses or any other organization that already has in place. Appian can integrate with solutions easily. The challenges, with using AI at the moment for its OCR capability is that handwritten notes, it's very subjective. So AI needs time to learn. And the problem with the notes is that everyone has different handwritten notes. So we will have lots of different sets of machine learning algorithms to make it efficient. And sometimes, if a human cannot recognize it, then the machine might not even be able to recognize it themselves. But it's the success rate is still pretty high. We found that the success rate with Google AI is around 80 to 90%.
Great, thanks, Tommy.
Pankaj, can I kind of weigh in on answering that question as well?
Sure.
Okay, so Excelerate's proof of concept, and it's a proof of concept, was crafted to demonstrate that we can achieve process optimization for providers by leveraging their current people, process, and technology. So we can come, so we're not trying to solve the whole end-to-end of getting the data, submitting the data, sending it over to the providers, getting the data back. We're trying to optimize the process with what we have to work with today, knowing that Fire, DaVinci, HL7, and the whole interoperability final rule process from CMS is dramatically changing everything. So we can go into a provider and we can leverage their existing technology, whatever their EHR is, if they already have a tech investment in intelligent or in artificial intelligence and AI, if they already have a workflow management or an RPA tool such as UiPath, we can leverage any of those to help them optimize their current environment tech stack.
Great. That makes sense, because hospital that's a great point, because most of the hospitals and everything, they are using some technology. We are here to, you are saying basically you can enhance and work with the technology if they are using technology stack. That is great. Next question is for Monique, for you. Cindy is asking the question like, so you talked to Lori, you understood the process, then you defined the workflow, and then Tommy completed the implementation piece of this intelligent automation. So the question to you is, what you define and what you got after the POC, how close it came, the POC, in terms of intelligent automation, the process that worked, in your opinion?
It was absolutely, I think, exceeded what Lori and I had anticipated. What I was able to give to Tommy as the basis of what we were trying to accomplish, he extended that with his knowledge of the product itself. So I think overall, it met our expectations and exceeded it, just because he was very knowledgeable about all of the things and the options technically that were available.
That is great to hear. That means, like, I mean, this partnership worked well from the subject matter expert defining the requirement. To your point, Monique, earlier you mentioned it was so critical for you to define the requirements upfront. So then by the time the development and implementation team takes on, it's like things are pretty clear. Great. Lori, this is one question I have actually for you. In this whole prior authorization process, like, who benefits the most? Is it the patient, is it the provider, or is it the payer? Means, I know it's a tricky question, but I mean, if you can educate me and our audience, that would be great. What's your opinion?
First and foremost, the patient is going to benefit. They're going to be able to get and receive their clinical care and patient care much faster. The second group of people that are going to benefit is going to be the providers. They're going to be able to lighten their administrative burden and actually direct their resources to focus in on patient care more directly. And they're going to be more comfortable that they're going to get reimbursed for the services that they are providing.
Great, thanks. So, I mean, it seems like, and I encourage our audience to please continue sending your questions. I'll see if I can get it. But seems like, Lori, you, Monique, and Tommy really had fun working together on this, improving this process and workflow, actually automating it. And it was done pretty quickly. I think Tommy said 2 weeks, and then Monique said about the similar time frame. So given this time frame, things can get done pretty quickly. So if
Yes.
any of you, Lori, Monique, Tommy, anything else you want to add before we wrap up? Anything which we didn't cover, you would like to make sure audience understand?
Yes, the one thing that I would like to say is Monique and Tommy were a pleasure to work with, and the end result demonstrates to the companies and the health systems and the providers that we're talking to within health tech that Excellarate can deliver a highly customized process optimization to them with very high ROI in a short period of time that they can leverage their existing technology. This is a win-win-win situation. And we can, so because each one of these organizations and each one of the payers that they're working with have their own nuances. We don't have a one size fits all that we're going to make them retool their staff or change their processes. It's like we can leverage what they already have in place and just make it operate more efficiently and effectively.
Great. Thanks, Lori. Monique or Tommy, any last words for our audience from your experience?
From a business analyst perspective, it's just always a good match when you have someone that's very knowledgeable like Lori was about the process, who was able to give the time and had the answers to the questions, so that I was able to set Tommy up for success and able also to set myself up for success, to make sure that we understood what our mandate was, what our goals were. And I think that that's probably one of the biggest reasons why Tommy exceeded expectations, because he had that overall vision of what we were trying to do, not just the singular requirements of exactly what we wanted. So I think that engagement and that knowledge coming from Lori was really helpful.
Great.
Yeah, I totally agree. Yeah, Lori and Monique definitely set me up for success based on all the information and knowledge they provided. And it's always very rewarding to be able to build something that could potentially make a big difference.
That is great to hear. And I think I think that's about it. So let me summarize what my key takeaways are from the discussion. First of all, I thank all of you. I definitely learned in this process for sure. But what I get, my big takeaways from this discussion is basically intelligent automation of a prior authorization means simplify the complex workflows, manual workflows, while maintaining the compliance. Like one audience asked about HIPAA compliance. So we can do all that stuff. Also, more importantly, Lori, you mentioned like it enhances customer satisfaction. And I heard you say like the most benefit is to the patient. I am like a patient, like, so it enhances my whole experience dealing with this and reduces friction. So friction, basically, that's what I'm gathering. And on the provider side, I heard intelligent automation basically reduces cost per PA, right? Because you are eliminating the manual processes as much as you can, thus creating the business scalability. And lastly, I think resulting in reduced delays, basically in treatments of patients and in receiving payments for providers. Because one of the stats I was reading somewhere in, I think AMA published a very nice survey, annual survey in the PDF. And it kind of said like 91% of the patients reported that prior authorization can lead to negative, providers reported, sorry, 90% of the prior authorization can lead to negative clinical outcomes. So if we automate the processes and everything, so a lot of those things can be eliminated. And it's, as you said, Lori, correctly, the win-win situation for everyone. Did I summarize my learnings, key things, or did I miss anything big, Lori?
It's really boils down to the economics, the efficiencies, and the effectiveness, and all for the effort of delivering better patient care and better patient outcomes. So, like I said, it's pretty much a win-win across the board.
Great. I don't see any other questions, so I think that's a wrap. Thanks again, Lori, Monique, and Tommy for a great discussion and providing us insights on prior authorization. I want to thank our audience and for your questions attending this Zip Chat. Feel free to reach out to us if you have more questions or if you want to have a follow-up discussion with any of the panelists or me. As Jill mentioned earlier, you will have our contact information. Any questions you may have, just reach out to us and we should be able to, would love to talk to you what processes you are going through and what processes you would like to automate. So I think thanks everyone, thanks panelists and audience for joining, and thanks and have a great day, everyone. That's it. Bye.